Welcome back to MTN Live in the Mountains. Now on the couch with us, we have Alice Salthouse and Brian Belcher, and they're with the High Country Community Health. Guys, thanks for coming in and speaking with us today.
Absolutely.
Yeah.
So tell us a little bit about what High Country Community Health is. Y'all just opened up in January. I know you're probably really excited. Tell us a little bit about, about what y'all do.
Okay.
We are very excited to be a part of healthcare, a new thing in the High Country. We are what is called a federally qualified health center or a community health center. And we've been open for about a month now. We received federal funding to help us set up this clinic, and we see anyone who needs care regardless of ability to pay. We see those people that are not able to pay or people that can, and we provide good care.
That's great.
That's wonderful. So I'm really interested about the paying situation. So someone can come in and get care, and what do they do if they cannot pay for the services?
Okay. Well, it is regardless of ability to pay, which means that we do an eligibility screening process.
Okay.
So someone might come in and need to see the doctor, and what they would need to do, they would get in, and the sliding fee scale that we have slides down to $20. So it could be as little as $20 for anyone, and it's 200% of the poverty level or below.
And poverty level for a family of four is about $22,000. So you could be a family of four, make $44,000 a year, which up here is really common because with our tourism wages, people are, what the term we use is underemployed. You have a job but no benefits. I know we all know how that is. So you could have a family of four, $44,000, and we could still provide you really affordable care. Whereas you go to a regular physician, and we have some awesome physicians in this area, you may pay $75, $80, $100, $120. We can do it for $40.
That's great.
And we have amazing providers. Both our providers are bilingual. We have an internal medicine doc that's got over 30 years of experience. I mean, he's been being a doctor, a lot longer than our college students have been on this earth, so we feel like he's got a lot of really good experience. And we have a family nurse practitioner that's also bilingual and came up here just to work for a community health center. So they love their jobs and are excited to be here, and we're thrilled to have them here and be able to offer this resource in the community.
Whose idea was it to bring up a community health center up here into the High Country?
Alice has a vision which she can tell you about. It's been awesome.
Well, Brian and I have both been involved in public health in this community for 7 years and 7 years plus, and in the state. And it's a big deal for people to have access to health care.
Yes.
Right.
And it's a problem. And you've heard people talk about the situation where you have to make a decision whether you're going to buy groceries or go to the doctor. And that's just not the way that we believe or think it should be. You should be able to get access to care. So we worked with Appalachian Regional Healthcare System in the Community Outreach Department. And a big part of our job was to try to seek grant funding for these types of programs in the community. There is a program at Watauga Medical and Cannon Memorial where people who have chronic disease and are uninsured, low income, they can access care. It's called Appalachian Healthcare Project, and we worked with that program. But we also have seen that there's still a need beyond that, because those people that are not chronically ill also need to have access to care. Anybody that needs access to care. So while we were there, we were made aware of grants and opportunities across the state and across the nation where we could access this funding. So we wrote this grant in 2010.
And it took 9 months to write, so we called it birthing the grant.
Yes.
Obviously, it was a very enduring process.
Right.
Yes, and then we had a long wait because of the judging process that goes on. And in June of this year, we heard you have been funded. And it was a big deal for this High Country to have a community health center with the federal funding, with this opportunity. It's a big deal.
So the federal funding is basically how you're able to do this, because
it is a part of it.
Okay.
It does not entirely pay for the. You have to have a good business plan, and but a portion of it allows you to be able to see those patients that are uninsured.
Okay, yeah, because I mean, if you're going to an ER in your normal hospital, it's going to cost you a lot of money to do that. So,
$100,
I was just wondering, what are the steps of how you guys are able to do that? I guess like you said.
So we get federal funding, we
Right.
get some other grants, and then the federal government says, all right, I'm going to give you the seed money, and you better figure out how to do it. And also, if we see Medicaid, we get extra enhancement.
Okay.
So we love our Medicaid patients, we love our Medicare patients, our private insured. So the government says, you see these people that can't have insurance or don't have insurance, but also you better see some people that can pay. So this is a real neat, unique opportunity. So if you have private insurance and come see us, not only are you getting awesome quality of care, you're actually helping your community, because each insured person that we see will basically help us pay for an uninsured person. So it's a really easy way for people to be charitable and get good health care.
That's great.
What is your mission statement?
That we will provide quality care regardless of ability to pay for the high country area.
And even though we're new, this model is about 50 years old. So
Right.
this is a well-proven model that the federal government, and this is one of the few streams, and we all know how bipartisan and just crazy federal government is right now on state level, but this is one of the few funding streams that has not been cut in 50 years because
Wow.
both parties actually, the novel idea, support health care for everyone.
Yeah.
And once you become a federally qualified health center, you are held to a very high standard of care. We are required to collect data on the demographics of our patients so that it shows that we're doing a good job in meeting the need of all the whole population. We also have to collect data regarding outcomes. Like if you have a patient who's diabetic, you want their lab results to fall within a certain range.
Right.
And we're held to a higher standard. And we have to report these results to the federal government, and we have to do a good job.
Right.
And we have dental care as well.
Okay.
So we're one of the few places you can come and get your medical and dental care in the same facility.
Wow.
So I feel like we're pretty awesome.
Yeah, I think so
And you
too.
pretty much anything.
Well, we
We can
can.
do a lot.
We can't. We're in the primary care business,
Yeah.
and we can work with specialty physicians and with the hospital and with the health department, and we're just a piece
Yeah.
of the healthcare
That's true.
whole landscape.
Right.
But it's an important piece, and I believe that we do a good job because in this community, the healthcare system, Appalachian Regional Healthcare System, Appalachian District Health Department, and now the Community Health Center, we talk to one another, we work together, and that benefits the patient.
And we're in Watauga and Avery counties.
Yeah, I was
by the
about to
way.
ask, but
Yeah.
I feel
Yes.
like you were in another county as
Yeah,
well.
absolutely. So we're offering that both medical and dental. In Avery, we worked really collaboratively with the health department. So we're in the Avery Health Department right now, which is a little bit small, but awesome. So we're working on a campaign. We have a $750,000 campaign right now to get into a 10,000 square foot building in Avery County.
Yeah.
So if you go to our Facebook page, you can look, or our webpage and donate. Once we get in that building, hopefully late summer, we'll have 6 dental operatories and 9 medical rooms, and we're really excited to be there in Avery.
Okay.
Where are y'all located here
yeah.
in Boone?
We are operating out of the Watauga County Health Department.
Okay.
And it really lends itself to giving good care because there are a lot of programs that take place in the health department. For instance, immunizations and other programs that you get at the health department that you just go one place and you can be seen by your physician or you can have your shots.
And we're on the Apple Cart route, so if you can
We
tell
are.
us
That's great.
transportation.
Even better.
Yes, yes.
That's so wonderful. Is there anything else you guys would like to tell us about your new health care?
Well, we are a community health center, but we're also a migrant health center. And as you might know, we have a good Latino population in this area because of the Christmas tree industry and the hospitality industry.
Right.
And so we always have enabling services. So if someone that is Spanish speaking comes to the clinic, we can take care of that. We've got people there. We have providers who actually speak Spanish.
Wow.
And that's really important too.
That's great. Well, you guys are able to reach a lot of different people in the high country too, and then definitely provide a health service that's affordable. And I think that's the one thing that a lot of
Affordable
people
and high
need.
quality
Yeah.
as well.
That's great.
And we're excited. We feel extremely blessed to be a part of what we're doing here. And I think it's a good thing for the high country.
No, I definitely think so too. It's you guys are wonderful.
Thank you.
So wonderful.
Well,
Thank
guys,
you.
thanks for coming on and
Absolutely.
speaking with
Our
us.
pleasure. Thank you for having us.
Yeah. And we'll be back in a minute with more MTN Channel 18.